Good afternoon, everybody. I'm Janet Hughes. I'm a reporter from Gloucestershire Live, and this is our third session in collaboration with Gloucestershire Hospitals, who are trying to outline their vision of the future to you because they want to talk to you about what they think might be the best way forward. It's under a banner called Fit for the Future. We've had Fit for the Future 1, which has been and done and gone about 18 months ago. And now they want to talk to you about 6 more specialisms and their vision and ideas for how they see them being delivered over the next couple of years. So basically with us today, we've got the interim chief executive, Mark Pietroni, and we're going to talk about benign gynecology with Dr. Mark James, Mr. Mark James. We've already done sessions on respiratory frailty, and now this is benign gynecology. And I'm just going to introduce Mark Pietroni to tell us a bit more about it, and later on we'll discuss how you can get involved and how you, if you've got any questions, send them in and we'll ask them at the end, at the last 15 minutes of the show. So good afternoon, Mark, and can you tell us a bit about what For the Future is and what it isn't?
Thanks very much, Janet, and thanks again to Glos Live for hosting this event. So Fit for the Future 2, what is it? Well, Fit for the Future 2 at the moment is a conversation with the public about our ideas around, as you said, 6 particular areas. They're not firm proposals, they're ideas that we have, and we're talking to the public, to our staff, and to other people who are interested in this, and saying this is what we think we'd like to do, what do you think? And then in due course, we'll come back with firm proposals. So we call this engagement. And when we have firm proposals, we go out to a more formal process called public consultation. And Fit for the Future 2 is less about where services are, and it's more about how we can best provide services and use the resources that we have, whether that's either Cheltenham or Gloucester or any of the community hospitals, or even primary care, as we talked about in respiratory settings, to provide the best care for our public. Just a note to what it's not about. So Fit for the Future 2 is not about going back over the conversations in Fit for the Future 1. No part of this is about saving money, and it's not about talking about Cheltenham A&E, just to put that out there. So we in the Trust have this clear strategy around centres of excellence. We like to think of ourselves as one hospital with 2 campuses, one in Cheltenham, one in Gloucester, with a centre of excellence for planned care in Cheltenham and a centre of excellence for emergency care in Gloucester. But that doesn't mean that all planned care happens in Cheltenham and that all emergency care happens in Gloucester, but it's an increasingly clear separation of our services, which enables us to provide better quality of care, particularly in the context of planned care, better patient experiences, fewer cancellations, and it also enables us to make sure we're making the best use of staff who are both our best, but also in shorter supply resource at the moment. And we are investing in both sites to do that. So, for example, in Cheltenham, we're investing millions of pounds at the moment in building a new specialist day surgery unit with 2 new theatres, and we're investing in the Gloucester site, excuse me, to improve the facilities for the emergency department and the acute floor. I'm happy to stop there, Janet, but if there's more you'd like me to say, then please ask.
Just wondering what and why you want to involve the public in this.
Well, all sorts of reasons, really. We're interested in what the public says. We're here to serve the public, not vice versa. I think traditionally hospitals can sometimes have behaved in a way in which they say it's easier for us if you do this, and we design services that better serve the needs of the hospital, and what we want to do is design services that best serve the needs of the patient. Now, of course, there are trade-offs in that, particularly when you've got 2 sites, one in Gloucester and one in Cheltenham. Not everything can be done on both sites, and not everybody will be happy if it's done on one site or the other. In order to balance those trade-offs, it's really important that we hear what's most important to members of the public.
Okay, thank you. And now we'll talk to Mark James, who is a gynaecologist. First of all, Mark, can you tell us a bit about your specialism and what it involves and the kind of things you do in your department.
Yeah, I mean, that was cancer work we deal with in Gloucestershire Royal, and we've been here since 2011 when the new maternity unit opened. So we work very closely, performing major surgery and day case surgery. But like all things, theatres is a tricky, busy place, and we need to be able to share things out. So we then discovered that we've been doing, for instance, in Stride, some operations, day cases and patients just are in for half a day and able to go home. So that's when we have then been looking at how we can utilise theatres in Cheltenham. So we've been able to change slightly and provide some of this more minor surgery that's suitable in Cheltenham.
What kind of things are we talking about with that minor surgery?
Well, things like cystoscopy to look in the bladder. We can do keyhole surgery, and so we can remove ovaries and ovarian cysts and perform diagnostic laparoscopies, for instance. So things that would involve the patients usually just being for half a day, and they're able to go home safely afterwards. So it's just a good use of space, and it means that we're not having to take up the major theatres in Gloucester all the time. So it means we can get more inpatient care done.
So, as I understand it, what you're saying is that a lot of the day cases, am I right in saying it, about 75% would be done in Cheltenham under your idea for the future, but all the outpatients, the community work, all the follow-ups, people would just carry on as normal and be able to access those services at Gloucestershire and in the community?
Absolutely. I mean, we do clinics all around the county already. So they are being able to be seen locally. In that point of view, we've operated at Stride for many years now, performing day case surgery as well. So, and some patients, it may suit them better to come to Gloucester, and that will be fine. It isn't that we can't do the day cases here. It's in nice facilities in Cheltenham as well. So it's maybe somebody from the forest is a slightly further trip, but they'll have the option to come into Gloucester if that suits them, or go on to Cheltenham. So.
And I'm saying, there will be a benefit to coming into Cheltenham. I understand brand new theatres.
Yes, I mean the theatres will be new. I mean, I've not seen them yet. They've been quite completed, but certainly the whole experience is probably going to be slightly less chaotic. No doubt at Gloucester, it's a very busy department with lots of theatres, lots of patients. So I think just by the nature of it, because overall there's fewer theatres than Cheltenham, it always seems a little bit calmer. And I think the facilities will be quite specifically geared for day case surgery, and therefore the patients, I'm sure, will have a much better experience.
And benign surgery and non-day case surgery, where would that be carried out?
Well, we continue to do our major surgery. All our inpatients are based at Gloucester because that's where our junior staff is. So all emergency admissions and major operations and a lot of outpatient work as well is carried out here as well. So it's not really going to impact on that at all.
Mm-hmm. So from what I understand, and correct me if I'm wrong here, I'm just trying to summarise really, what I understand, everything will carry on as normal for most things, but if someone needs an operation and it'll just be a day case one day, those people will be suggested that they go to Cheltenham because the facilities will be better, and I presume it'll mean will it actually improve waiting times as well?
Well, overall, we're going to have the same number of lists, but the hope is it's much more efficient sometimes to have a whole list of day cases rather than interspersing them with the majors. So one would hope that, and if for instance, sometimes in winter pressures, we struggle to get patients in to Gloucester, and so in fact, the benefit will be through the winter, they're more likely the list will function and carry on throughout it. So that would be one big benefit for them.
Mm. And do you know how many patients roughly this might be? Do you know when we're talking of how many?
We probably perform maybe just over 1,500 operations, day case operations a year. So we'd probably be looking at 700, 800 patients would hopefully go through the doors there.
Mm-hmm. Yeah, and like you say, you'll continue to see people in the community as follow-ups. they won't have to come to Cheltenham from the other side of the county for follow-up
No, that's
consultations?
That's completely correct. I mean, the local services and clinics in the Forest and Stride exactly take place. There'd be no additional clinics, for instance, based in Cheltenham, so there would be no need for them to be followed up there. It's more just to come there for the surgery.
Okay. And in terms of what you think about this, you think this is better for the patient as a clinician?
Well, the facilities are certainly going to be much better. It's going to be a much nicer experience. We're comfortable because we've already used even Cirencester and Stride historically, so we do have experience at day case surgery and know what is safe to be done and to lie the patient. So I think it will be better. It just gets them access to theatres, and it frees up a bit of theatre time in Gloucester to allow other services to use it. So I think all in all, it's a win.
Okay then. Well, thank you very much, Mark, for explaining that. And I'm hoping we can come to Mr. Pietroni, who can tell us a bit more about how people can get involved with this. And are there any potential drawbacks? I forgot to ask Mark that, actually.
Yeah, just a couple of comments, if I may, Janet. So Mark has really well outlined the benefits of the service. Not only will the facilities be nicer, a better patient experience, and as he suggested, less likely for there to be cancellations, particularly during times of high pressure in the winter in Gloucester. But also, if you have a dedicated day case facility, then again, as Mark said, we tend to get a bit more efficient. We get a few more operations done, which actually means that waiting lists will go down. And he did mention some operations that might not seem minor to patients, such as removing ovaries, but that's just a medical term in the way in which we classify patients. So please don't be scared by that. This is work that we do routinely as day cases now, and we're seeking to do more of it in Cheltenham for all the reasons that Mark suggested would be better for patients. So if you want to get involved, please look at the website. Hopefully it'll appear below. Brilliant. getinvolved.glos.nhs.uk. On there you can find a form to fill in if you'd like. You can download the brochure that explains more about what we're doing. There's a questionnaire. There's an email that you can just email free text comments back to. There's also a bus that's going around the county, and various outlets, including the website, have the dates of when and where it will be. BBC Gloucestershire is publicising them. I'm sure Glos Live is too. So do please feedback and let us know what you think. One of the drawbacks, of course, is if you're on the other side of the county, you might have to travel further for your operation if you're going to Cheltenham, as I explained before. For day cases, that's less of an issue, because when we've spoken to the public before, particularly as part for Fit for the Future 1, what they said clearly to us was, yes, get us to the right place first time as quickly as possible for my treatment, the right specialist, and I don't mind which site it's on. It's, of course, different if you're a relative or a loved one and are visiting people, particularly if you are elderly or frail or have difficulty travelling for other reasons. With day cases, that's less of an issue. But again, people may be using family or friends to transport them to and from Cheltenham. And if you are further away, that is, of course, a drawback. We do work quite hard on communication, particularly around public transport options. And there is a bus that runs between both sites, which helps. But we recognise that transport is always going to be one of the issues that can be a drawback for some people in one part of the county if services move from one of the hospitals to the other.
Mm-hmm. But Mark seemed to suggest that because there will still be cases at surgery, it might be a case of you can go to Cheltenham early, but you might have to wait a bit if you want Gloucestershire. Maybe
we always look at exceptional circumstances. It's very common in healthcare. We have standard processes and procedures. We do this procedure in Cheltenham, but if we get a letter in from the patient, or sometimes from the patient's general practitioner, that says for this and this and this reason, can you really try and do it in Gloucester or vice versa in Cheltenham? We will always do our best in those circumstances.
Because I was going to say to Mark, actually, because it may sound like not very much to people, those those conditions, because it's day surgery. It may not sound serious, but they can be very distressing to the people involved, can't they?
Oh yeah, I mean, coming into hospital and having an anaesthetic is a traumatic time. I've had one myself, I've got to say, and was quite anxious going in. But I did actually have it in Cheltenham as a day case, and quite a good experience actually. But anyway, I think our anaesthetists are very good, and I think they're always there to reassure patients and take not to worry. We've got quite good information leaflets, and hopefully the patients find that they're fully aware of what to expect when they do come in.
And the conditions themselves as well. The people will be quite keen to get them sorted quite quickly, I presume.
I think the one thing through COVID, because we weren't able to operate, so we learned to prioritize and grade how soon we need to get people in. So there's no doubt if somebody is suffering with their symptoms, we really endeavour to expedite their admission in order to try and help them. And we have those discussions with patients, and those that don't have many symptoms are usually very happy to wait until they can come in. But obviously, suffering a bit, you're keen to get in sooner, and we endeavour to try and do that. And I think that whether we're in Cheltenham or in Gloucester, it would make any difference. I still think if it suits better to come into Gloucester, we still will be able to prioritise and get them in.
Okay then. Well, that's really interesting. And this is, like I said, this is a series of 6 broadcasts that we're doing to find out a bit more about the ideas of Gloucestershire going forward. We've got, on Friday, we've got stroke. On Wednesday, we've got diabetes. And the following Wednesday, we've got diabetes. And the Friday afterwards, we've got cardiology. So the hospital are really keen to hear from you. They want to get involved in a dialogue. They're in listening mode, as they say, and they want you to get involved. So please do take the opportunity to get involved in this engagement exercise. If you've got anything to say about what Mr. James said today or Mark has said today, then please get hold of look at the website, see how you can get involved and make your views known. And thank you both for being here. And I'll speak to you on Friday.
Thank you very much, Janet, and thank you again to Glos Live for hosting the event.
Thank you.